One of the biggest problems in healthcare is the lack of evaluation. So evaluation is finding the root cause of something. It's investigating to find the true thing that caused something. So I'm going to take in this video just one symptom and pull the string and show you what I do, because every time you treat a symptom, you camouflage the symptom and you perpetuate the problem. All right, let's just take fatigue, for example. We're going to take that as a symptom or a clue and go deeper. Now, the first thing that I do is I find out when did it start and then what happened just before you start getting tired to get a clue to find out what's causing it. So there's two main situations with with fatigue. Number one is you're not sleeping and you're tired, or you are sleeping but you're still tired. So I guess one of the biggest causes of fatigue is you're not sleeping. But that's a symptom again of something else. So we don't want to treat it. We don't want to treat this with 5-hour energy drink or treat this with a sleeping pill. We want to find out what's really behind it. So I'm going to show you some of the potential causes of not sleeping. Number one, it could be stress. It could be your adrenals are burnt out and you're stuck in stress because you've been pushing. It could be that you stopped smoking 20 years ago and you were so dependent on the nicotine that the stopping of smoking created stress in the heart because nicotine artificially opened up the coronary artery to the heart, and then you actually relaxed and you actually can breathe better. So when you smoke for many years and you stop, you could actually have a problem with your heart being tired because it's never adapted. So I have a lot of people that when they stopped smoking, after that they were just stuck in stress and they were tired and they couldn't sleep because of that one point. Okay, so it could be a physical reason. Maybe you have pain in your back. Maybe you have a pain in your neck and you can't get comfortable. What if it's a hot flash? That could be it too. Or maybe it's your sinuses. That's called sleep apnea, right? And they label it and then they treat it. But what causes the sinus? Let's go a little deeper with sinus. What causes sinus? Well, what causes the thickened mucous membranes could be a lack of vitamin A, right? We could have lack of vitamin A, but it could be you don't have enough bile from your gallbladder to digest the vitamin A, and that's why you're not absorbing it from the food that you're eating. And by the way, kale shake is high in vitamin A, and that's why it helps the sinuses. Or it could be the adrenals are so stressed that that high level of cortisol could cause atrophy of certain nerves in the back of the neck that go to the mucous membranes and swell up the sinuses. So a lot of people with adrenal problems end up with sinus problems because the treatment for sinuses are a lot of times steroids, because steroids are adrenal hormones. So that's another little causation. It could be allergies, but again, what causes allergies? A weak adrenal. So we're just trying to pull a string. It could be a nutritional factor. It could be low potassium, all right? Because maybe your diet's not high enough in potassium because you're not eating enough vegetables. Or it could be too much sugar that's pulling out the potassium. So we got to look at both angles. Could be lack of calcium because maybe you're eating too much junk food and you're not able to pull it because junk foods depletes calcium and B vitamins. So a lot of breads, pasta, cereal, crackers, biscuits, and waffles and pancakes can deplete the B vitamins that are supposed to be retained in the body and ending up with a low vitamin B. And then what happens is that you have nightmares and you can't sleep. So B vitamins help you sleep. It could be junk food. It could be alcohol. These are just factors that I'm always looking at. It could be environmental, where your bed is just not flat enough and it kind of sags and you need a new bed. Or it could be noise because your husband snores. Or what about your dog? Do you sleep with your dog? Some patients sleep with their dog. And I'm like, that's not going to work because the dog's fidgeting all night long. Or maybe you work third shift, okay? Another causation. Or maybe you're only getting 4 hours of sleep. So these are things that we have to pull a string and find out what's behind it, okay? But let's say, for example, you are sleeping and you're still tired. That could be a thyroid problem. Why? We got to find out why. It could be high estrogen levels coming from a heavy period of fibroid. Maybe you're eating too much soy in your diet. Or you just got pregnant and you spiked the estrogen and then the thyroid became a problem and then you couldn't sleep. So these are things that you want to dig deeper. It could also be a liver. Did you realize that your thyroid is dependent on the liver and it converts the thyroid hormones through the gallbladder? So without a good liver or a good gallbladder, if you had it removed, you can't convert those thyroid hormones, thereby creating a fatigue in your body. So these are things that are deeper than the superficial. Or it could be a virus that comes out of remission. So anytime the immune system goes down because of stress, a loss of a loved one, boom, immune system goes down and you get sick. Old viruses can come out of remission and it could make you tired. I have people that are in chronic like mono, which is Epstein-Barr virus, and they're always tired because of the low adrenal, because they're in a stressful environment. I've also had people tired because they had an old head injury, and ever since that injury, they've been tired in their head. Okay, it could be also our light sleeper, because the adrenals are so stressed out, your body can't get into the lower levels and can't relax. All right, these are all deeper levels. So, number one, never accept a symptom as being a problem. Okay, differentiate symptoms from problems, cause and effect, and always ask why, and that way you can really get to the bottom of it. I hope this helped. I'll see you in the next video.